I was recently asked about what are some of the reasons for leaky gut, or how could you know that you have leaky gut? So let's explore that a little bit because it is a huge indicator for potentially a lot of different disease and dis-ease in the body to be occurring. Leaky gut is also known as enhanced intestinal permeability, meaning that the small intestine should be absorbing the correct amount of nutrition and getting it into our bloodstream so that it can go throughout our whole body and nourish our other tissues and cells. But sometimes it can get too big, like the gaps where the nutrition goes through can get bigger, and that allows other things to move through. And therefore, other things that are undesirable can get into the bloodstream. And this could range from like bad bacteria, parasites, different toxins in the body. And then when that goes through your whole system, it's potentially landing in different areas, whether that's a joint, around nerves, around your skin, the list goes on. And that can cause its own irritant and inflammation and potentially even immune activation problem. So how do we know this? Well, there's different ways that we can look at it. One is just simply what are some symptoms and things that you might be routinely doing in your day-to-day or even like weekly life. So a few things that will make leaky gut more of a potential is regular use of NSAID medications, right? Over-the-counter medications, or even so whether that's like ibuprofen, naproxen, prescriptions like meloxicam and others, that will start to degrade the small intestine lining and increase that leaky gut scenario. You can also have exposure to pesticides and different environmental toxins, and chronic stress even, right, is a toxin and will cause damage within your system. Low vitamin D, or even just insufficient, maybe it doesn't have to be deficient, but not optimal levels of vitamin D. Low levels of zinc, antibiotic use, right? There's so many different pathways here that can have a big player. If your digestion isn't doing well, upstream, your pancreas, the stomach, then there's a chance that things won't be digesting well and they'll start fermenting and causing irritation to the small intestine lining. So those are a few things. And then especially if you're having problems throughout your body, not just your gut, but you're also having problems with maybe not just one or two, but like multiple joints in your body, headaches, migraines, skin issues, energy issues, just fatigue, right? That can all start to indicate that there could be a leaky gut component. And especially if there's an autoimmune dynamic, we really want to look at the integrity of the gut lining. So that's a little bit of what to look for, what it might be. And then from there is specific testing that can occur where we're looking for zonulin, which is a protein that gets released in the body that will really encourage that intestinal permeability to get better. And by the way, they're finding now that gluten increases zonulin in your body, which then increases the likelihood of leaky gut. And therefore, different disease processes can start stemming from that. So I hope that's helpful. Drop me some comments or questions, and I'll get to them best I can. Thanks.